Good evening. I'm Dr. Bissell, and I'm here to give you the weekly update on the state of the COVID-19 pandemic in the New River Valley. Today is Monday, December 7th. We continue to see fluctuating numbers of new cases in the range of 250 to 350 per week in the New River Health District. We expect that due to Thanksgiving gatherings without masking and distancing, we will still see that number grow over the coming days. I'm grateful that many families did take precautions, wore their masks, and met outside in the beautiful weather we had. This winter will be challenging, and I continue to urge everyone to stay vigilant in the coming months to protect yourselves and to reduce the burden on our hospitals. This past week, the CDC updated its quarantine guidelines, providing alternatives. Although the 14-day quarantine is still the safest, we have found that people are not always compliant. In Europe, they have seen compliance improve with a shorter quarantine period, which ultimately gives greater protection to the general community. Previously, we have advised people who might have been exposed to COVID-19 to self-quarantine for 14 days. If you have not shown any symptoms, you can now end quarantine after 10 days. You can end after 7 days with a negative test in the prior 48 hours as long as you are not showing any symptoms. You would still be expected to mask and to distance, which we all should be doing when out in public. Anyone who develops symptoms should immediately self-isolate. Data shows that using those criteria reduces most of the risk of a person transmitting COVID-19. It's from the 2 days prior to the 5 days after onset of symptoms that one is shedding virus the most, and extending quarantine beyond 10 days doesn't yield much benefit. Locally, most of the people we ask to self-quarantine are not getting COVID-19. It's good to be cautious, but it can also be burdensome for people who have to work or care for others to self-quarantine for 14 days. Some people weren't quarantining or were cutting their quarantine short because they couldn't do it. These new guidelines will help us focus on that critical period when people are most infectious while improving compliance with public health guidance. We're also getting the great news that a very limited number of COVID-19 vaccines will most likely be approved and start shipping this month. Initially, the vaccines will be going to healthcare workers and nursing home residents, both of whom are at much higher risk of getting COVID and having serious illness. I'm very optimistic that we'll be able to get them protected and start seeing conditions improve. At the same time, the vaccine is not a panacea. It's not going to immediately solve our problems. It will likely take 6 months or more for the vaccine protection to make a dent in the pandemic. Meanwhile, we know how to control the spread of the virus. Bundle up and get outside. Wear a mask indoors. Watch your distance and wash your hands. Sneeze and cough into your elbow, then wash your hands. And please stay home when sick. These are the things we can do right now to keep ourselves and our communities safe. Thank you for everyone who wrote to me with their questions and concerns about the pandemic this week. My answers will be on the website nrvroadtowellness.com.